So what we're going to talk about today is going to really sort of mirror the conversation last week. So last week we talked about supplement strategies in acute concussion, and what we're going to talk about today is it's going to be a mirror conversation because it's very similar when treating post-concussion. We just tweak a few things, and I'm going to talk about that today. So to kind of really recap, good morning, folks. Hello. To recap kind of how we approach nutrition and concussion as far as supplementation, there's kind of 4 strategies we look at in terms of the pathophysiology. So what actually happens to the brain in concussion, and how can we use what happens in the brain to treat? And then beyond the 4 strategies, we'll kind of beyond the pathophysiology, we look at sort of symptoms and what's going on and how can we leverage what we're putting in to change the outcome of how you're feeling. Disclaimer, I'm going to say supplements. I'm going to say some specific supplements. This isn't medical advice. This isn't replacing what your care team is telling you to do. So don't change, add, subtract, alter anything in terms of medications or supplements based on what you hear on social media from me or anyone. Talk with your doctor first. So recap of the pathophysiology. So if you've heard any of my talks, even if you heard last week's, you've heard me say this exact same thing. We're going to talk about what happens in the brain in concussion. So again, bear with me if you've heard this a thousand times, but it's important because it's how we frame how we're treating. So when you're hit, there's a functional stretching and shearing of your neurons. The white matter and gray matter are different densities, and so they slide, and you get this functional stretching and shearing, and after that, there's this excitotoxicity and inflammation. So electrolytes go everywhere. When they stretch, there's electrolytes that are outside the cell that want to go inside, and inside the cell that want to go outside, and normally it's tightly regulated. But in concussion, when you stretch, when that white matter and gray matter stretch, it just goes everywhere. And it causes this excitotoxicity, which is where you feel kind of disoriented because your neurons are just like just non-organized firing, right? It's just kind of crazy, which is why you might be seeing stars or hearing sounds, because there's just this nondescript firing. The particular molecule we look at there is calcium. It's excitatory, it causes the release of glutamate, which causes the release of more calcium, and calcium clogs the mitochondria, and the mitochondria is where you get your ATP and you get your energy. So we tend to see secondary to that functional stretching and shearing, to that impact and concussion, to that excitotoxic soup, we tend to see an energy deficit because those electrolytes went everywhere, and now you got to put it back. And your mitochondria are plugged. It takes a ton of energy to put everything back because you're using sodium-potassium pump and all these different channels to bring everything back. And that takes a ton of energy. Also, within 6 to 8 hours, that stretching and shearing of the brainstem and your cortex causes the neuroinflammation causes gut inflammation, and that gut inflammation can cause neuroinflammation. So you can get this crisscross. So it was really, really rapid fire. I've done longer videos kind of going slow through this. I've got static posts. I've got posts on my blog. I talked about it last week, but that's kind of the rapid fire. Functional stretch and shear, excitotoxicity, neuroinflammation leading to an energy deficit, and simultaneously you've got some gut stuff going on. You got leaky gut, which I'm going to talk about in a post later this week, that it's probably not leaking paracellularly. It's probably not slipping through the cracks, but it's probably an upregulation of these other cells in your gut. So symptoms should typically peak 3 to 5 to 7 days, kind of within that 5-day window. They're their worst after concussion, and then they should go away within 7 to 10 days. And if they don't go away within 7 to 10 days, you're kind of drifting towards that post-concussion bucket. And when we talk about post-concussion syndrome, or persistent concussion symptoms is what we're calling it now, persistent post-concussion symptoms, persistent concussion symptoms, all these different acronyms, but it's the same thing. Your symptoms lasted way too long. And so if it lasts longer than 14 days in an adult, or if it lasts longer than 30 days in a kid, you are now diagnosably post-concussion. You have persistent post-concussion symptoms. But considering that they should go away within 7 to 10 days, if they last 14 to 30, we should be addressing that. And so what I talked about last week was the 4 strategies that we look at is you've got 4 kind of big things going on in concussion. You've got this functional stretching and shearing. So strategy 1 would be to support the structures. Strategy 2 would be to mitigate or regulate that inflammation and excitotoxicity. And strategy 3 would be to provide easy energy, support the energy deficit. Strategy 4 is really prevent as much of that metabolic damage as possible. And we're going to talk about prevention next week. So in terms of energy support, last week I talked about creatine, exogenous ketones, medium-chain triglycerides, acetyl L-carnitine. In terms of inflammation and antioxidant support, again, I talked about last week, curcumin and acetylcysteine, vitamin C, vitamin E, vitamin D, alpha-lipoic acid, things like that. And then in terms of structural support, I talked about structural support of your brain in terms of like omega-3s, particularly DHA. And you can use things like alpha-GPC, which also helps with cholinergic systems. Cholinergic meaning acetylcholine, and acetylcholine is typically associated with like focus, memory, attention, things like that. When you look at the drugs for like Alzheimer's or dementia, they're acetylcholine esterase inhibitors. So basically they keep acetylcholine in the system so that you ideally have better memory and attention. So so structural support, omega-3 fatty acids, CDB choline. And then I talked about within the gut, I talked about things like glutamine and probiotics, things that are going to help with the integrity. So that's kind of acute concussion, what we talked about last week, wrapped up in less than 5 minutes. I think we've gone 6 minutes here. So more than 5 minutes, but less than 10. So how do we shift it? We've got all those same things happened in a concussion. So how do we shift it to leverage more towards post-concussion? How do we make it work for a persistent concussion symptom patient? And I kind of shift the focus. So if you have symptoms that last longer than 14 to 30, if they last longer than 7 to 10 days and you've hit that 14 to 30 day mark, a lot of people watching might have 3 years or what, like 12 months, that's a year, 18 months, 3 years, 27 years. I have people on TikTok reach out saying like, it's been 16 years. So what happens? Like, it's still not this acute stretching and shearing. It's still not this acute excitotoxicity. Like, that's done. So why do you still have symptoms? And one of the things that we think about is we break it into, I tell patients they're buckets, but they're roadblocks, they're categories. There's 5 reasons you probably have persistent concussion symptoms. And I've talked about this in other videos as well. But there's an autonomic physiologic reason. So you've got dysregulated blood flow, still secondary to the concussion. So the energy deficit is probably better. I always do this because I talk about the graph of concussion, your energy levels dip, and it takes 22 to 45 days to get back. But if you're after that 45-day mark, you're at 100 days, 3 years, 5 years, your energy levels are probably back, but there might be a blood flow dysregulation issue still present. There could be a metabolic hormonal issue, and we'll talk about that in terms of persistent inflammation, gut inflammation, kind of the systemic inflammation, or a hormonal deficit. So we'll see not even necessarily a deficit, but a dysregulation. You might have too much, too little imbalances in your pituitary hormones, because your pituitary hormones, it sits right below the hypothalamus and the sella turcica. And it's this bony little structure that holds if this is my pituitary gland, it kind of holds it. And as your head jostles, it's just chilling in this little bony cavern. And it can kind of disrupt normal pituitary function. So dysregulated blood flow is one reason you might have persistent symptoms. Metabolic, so persistent inflammation, hormonal imbalances is another reason. Could have visual vestibular dysfunction, could have cervical spine dysfunction. And there's almost always, if you have symptoms for 3, 5, 7, 20 years, there's almost always a psychological component. That's not to say like it's in your head. That's not to say like, it's not saying it's in your head. It's to say that there's almost always an anxiety, depression, PTSD component that having a professional third party counseling, in some cases medication, there's research on, I know concussion doc, Dr. Cameron Marshall just talked with former NHL player Daniel Carcillo on the research in mushrooms and like psilocybin and things like that. So mental emotional health is equally a bucket that you could carry. And then I tell patients, like, you've got one of these 5 buckets: blood flow, metabolic, visual vestibular, cervical, or psychological. And my job is to find out which buckets you're carrying and to kind of empty the bucket or to make it lighter so that you can move through your world better. So how do we leverage supplements in this category? The one that we can really do is we can really play with this metabolic hormonal bucket. We can really try to figure out what's going on in terms of persistent neuroinflammation. Is your gut inflamed? Is your blood inflamed? Is the juice you're bringing up to the brain supportive or not? And so the way that I shift it is I'm going to break it up. I keep looking at my notes here so I don't get off track, because I can get off track. So how I shifted in chronic patients is I'll look at gut function. Gut function matters. So I look at gut function. I get more aggressive with inflammatory support. From a symptom standpoint, I get a little bit more aggressive with like cognitive, mental, emotional support. And then I'll talk briefly about hormones in a second. So breaking it down, gut function matters. So within, you got that stretch, that shear, that excitotoxicity, within 6 to 8 hours of you actually hitting your head, there is blood-brain barrier inflammation and kind of leakiness of the blood-brain barrier. And we argue that goes down to the gut, and you get inflammation and leakiness of the gut by way of this gut-brain axis. And so if there's inflammation and leakiness here, there's more inflammation and leakiness here and here and here and here. And it's kind of this vicious cycle that if in the acute stages you didn't manage it, it might be a problem causing your persistent stages. And so I think I've talked about this before, but lipopolysaccharide, LPS, is this bacterial endotoxin. So this thing that comes off of this bacterial piece that comes off, and it's super inflammatory. Lipopolysaccharide is super inflammatory. One LPS exposure to the microglia, so the immune cells within your brain, one LPS exposure can keep that microglia kind of inflamed and primed for 10 months. So one exposure here could be 10 months of inflammation here. And so that's why we worry about, it's not why we worry, but that's why we address the gut in terms of persistent concussion symptoms, in terms of the acute concussion phase. And the reason that I'll argue, and I'll share a post later this week, but the reason we talk about, that I've been talking about, we probably shouldn't call it leaky gut. We don't have this increased paracellular transport, is because if you took all the LPS in one human, so if you took all the LPS and kind of bacterial toxins in my body, there would be about a gram of bacterial toxin. And if I individually injected that into different humans, we could kill hundreds, if not thousands of humans with that LPS, like kill hundreds of thousands of people with that LPS. So what we're saying is it's probably not leaky because you'd be septic, you'd be dead. There's probably an upregulation because we know that inflammation can increase paracellular transport, but we don't see that paracellular transport actually supports the leak of bacteria and bacterial products because it's just too large. So what we might be seeing is when we see increased LPS in the blood, or when we see it, it might be actually an upregulation of these M cells over immune patches in your gut that are just like, oh, we're inflamed, we got to check everything. And it ends up checking more bacteria kind of into the system. See, that was why I go off tangent. So gut function matters. That gut-brain axis, that LPS inflammation loop matters. And one of the things we'll look at is, well, we can look at CRP, ESR, we can look at kind of normal inflammatory markers, homocysteine, but we can also look at more functional testing. So like IgG food testing, and you'll see examine.com poo-poos this. You'll see allergy research groups poo-poo this. But you'll see when they compare it to like applied kinesiology testing or something, we've got the most kind of science and they have the hardest time disproving it. I think they just don't like it because this is kind of put the foil hat on the conspiracy. Most of the foods that people kind of react to are foods that the food industry has a lot of money in, which is kind of interesting. Things like dairy, gluten, stuff like that. But foil hats coming off. IgG food testing is really, really useful in terms of we can see, this is a sample test, but we can see which foods that you're producing an elevated immune response to. So IgG is an immunoglobulin, immunoglobulin G. When people talk about food allergies, they talk about IgE. So food intolerances are not the same as food allergies. Unless you're having like anaphylactic reactions to dairy, you're not allergic to dairy. You just don't tolerate it. And so IgE is Ig emergency, IgE, E emergency. IgG is God, I wish I could eat dairy, IgG, right? And so when we're looking at IgG, if it is isolated inflammatory, so if this whole column was in the red, if this sample individual was all in the red, we'd probably be worried about a more severe gut disorder. We'd probably be worried about like an actual, I don't say actual, but a less functional, more pathological gut disorder. Maybe IBD, maybe we're looking at Crohn's, ulcerative colitis, something actually aggressively inflammatory, causing physical damage that we could see on a colonoscopy in the gut. IgG, when it's isolated like this, there's just an elevation here, just an elevation here, just an elevation here. What we think is happening is through molecular mimicry, through basically some of these proteins get through. Some of these food proteins get through, and they look like other proteins in your system. They look like gluten proteins can look like cerebellar proteins. So what we get is these foods leaking through, probably not actually leaking, which I just talked about, but we get these proteins making their way through, and the immune system has a chance to look at these things that it normally doesn't get to look at. And so you have this elevated inflammatory response to specific foods that typically mimic other things. And so one of the things we look at in terms of gut function, bringing this full circle, is in the post-concussion, the persistent concussion patient, it can be really, really useful to look at a functional test like that, because you're not going to see it on a standard test. You're not going to see anything on a colonoscopy. And you might be eating otherwise healthy foods that are causing you an inflammatory response. So it's like a lot of people now, because almonds are in everything. Paleo is simply like almost like an almond diet. Like if you make a paleo cake, it's like almond flour, almond butter, almond oil, like almond everything. People are responding heavily on these IgG tests to almonds. If we're following that trend, I think the next thing would be coconuts. Everyone kind of responds to almonds, dairy, glutens, things like that. So you could be eating whole grain bread. You could be eating, like whole fat milk. You could be eating almond milk. You could be eating blueberries. I've seen blueberries and white potatoes show up in an individual who was doubled over in pain every time they ate, stopped eating that, and it was cool. So gut function really, really matters. So one of the things we can test is this IgG test to see where are you getting inflammation from your gut that you otherwise would not be expecting to get it from. And we remove those triggers, not necessarily forever, because I'm not a fan of restrictive diets. I know that naturopathic doctors are, we kind of can cause more eating problems than we can fix, because we create this orthorexic environment where everything's got to be guru blessed, organic from the hills. Or it's poison, which is just not true. I would rather you eat fruits and vegetables than not. I don't care if it's organic, guru blessed or not. Like fruits and veggies are better than no fruits and veggies. But we want to make sure that they work for you. So this IgG test is really cool. We remove them for 4 to 6 weeks, whatever, and we can also support the gut, just like we talked about last time with glutamine, probiotics, zinc, marshmallow, aloe vera, different things like that. When I say marshmallow, I'm not talking about like s'mores marshmallows. I'm talking about Althea marshmallow root that's kind of demulcent and anti-inflammatory in the gut, which is pretty cool. So gut function matters. We went on a long tangent there talking about LPS. I went way over time on what I thought I would talk about, but gut function matters. You got the gut-brain axis. Food triggers actually really matter. And we can also support it with supplements that work on gut integrity. So probiotics, glutamine, zinc, aloe vera, probiotics, digestive enzymes can help you kind of break down the food a little bit. Boswellia is an herb that almost no one talks about that's super anti-inflammatory. Curcumin, yada, yada. What probiotic do I recommend? It's hard to just generically recommend a probiotic. Most probiotics over the counter that you can get like in the store are dead, but that doesn't mean they don't work. So probiotics, because we haven't always had the technology, but we've seen benefit. So basically the dead particulates, the dead particles of bacteria that you're eating in your probiotic may actually have benefit as signaling molecules. But the probiotic that I typically recommend, again, this is not medical advice, but the company that I like is Claire Labs, and they've got one called Therabiotic. I like that. I like Megaspore Biotic from Microbiome Labs. It's a spore-based probiotic. But again, do not take or look for any of these things without chatting with your doctor first. Some people will take certain probiotics that also have prebiotics, and it causes them to be really bloated. If you do have an overt inflammatory disorder like IBD, you might not necessarily want to put bacteria into a gut with open lesions, because you do risk like getting bacteria into the blood, so we don't want that. So again, talk with your doctor first, but I do like Clear Labs Therabiotic, and I like Megaspore Biotic from Microbiome Labs. So, and then we also get more aggressive with inflammation. So gut function matters. I get more aggressive with inflammation and persistent concussion symptoms, because in the acute phase, I try to regulate. So I don't go super anti-inflammatory, because one of the things that we think is happening in CTE is you get this buildup of tau proteins within kind of where the white and gray matter meet. And we think, oh, maybe, like this, we don't know if the lack of protein clearance, this tau buildup, is actually causing problems, but we don't know that it's not. And so if you stop inflammation, like if you had this gaping wound on your arm and you just stopped inflammation, the wound would never heal. And so if we think about it, TBI is a traumatic brain injury. So if you just halt inflammation, you don't give it a chance to clear and bring in stuff and do the inflammatory dance, then that might be a problem in and of itself. So early on in concussion, I don't give people all the anti-inflammatories. I give a lot of energy support. I give some antioxidant support. I give some structural support in terms of, like, I really like omega-3s in the acute phases. But in that acute phase, I don't necessarily pump with anti-inflammatories, because I want the healing process to occur. But if the symptoms have lasted longer, so say you didn't get treatment, or you're coming into my office for the first time in 3-5 years and you still have symptoms, that's when I go more aggressive, because there's probably something going on in the gut, which I just belabored for 10-12 minutes. And there's definitely some inflammation going on up here, because if there's that metabolic component, and there's that gut component, you've definitely got this like microglial activation. You've definitely got some inflammation going on. So I get much more aggressive. You got to calm down the microglia, especially if the gut is wonky. So I'll go much more aggressive with curcumin, fish oil, NAC, different anti-inflammatories there, but it's much more aggressive in the persistent concussion stages. In terms of persistent concussion patients, there's a lot of people that tell me it's like this fog, or this kind of like, they're just not there. Like there's a patient I was talking with yesterday who's finally noticing that he's able to engage in like work meetings more readily. And that's kind of that. We like that. We like that. So one of the things we do is cognitive support. So even though there's not necessarily this energy deficit, we can still provide easy energy to a brain that might be inflamed, to a brain that might have visual vestibular stuff that's just sucking its energy, to a brain that might have cervical stuff sucking its energy. So we still want to provide some energetic support, but maybe not as aggressively as in the acute stage. And so I'll still use things like exogenous ketones. I still like things like alpha GPC. But in terms of kind of this mental clarity, and in terms of the fog, I also like things like green tea. I like things like L-theanine, because EGCG in and of itself is antioxidant, anti-inflammatory. We find that in the green tea. L-theanine is one that's sort of, it's not going to put you to sleep, but it can calm the, I was going to say calm the brakes, but it's not going to push the brakes. It can calm the system a little bit. We see increased alpha waves, which is a state kind of associated with a little bit more mental clarity. It's what we try to achieve with our paced breathing. But it's paired well with caffeine, because it cuts the jitters off of caffeine without slowing you down. So if that's kind of a way to wrap your head around it, L-theanine, when paired with caffeine, cuts the jitters of caffeine, but you keep the focus. So theanine, when taken alone, can help kind of calm the mind a little bit. So in these persistent concussion symptom patients who have a blood flow dysregulation, or who have a visual vestibular issue, that are kind of still always running, and they're like, I can't calm down from a cognitive standpoint, I like green tea, L-theanine, exogenous ketones, alpha GPC, things like that. Mental emotional support, again, we can get also with the cognitive support. I really like magnesium L3 in it, because people will ask about what form. Supplements to calm the nervous system. Yeah, so L-theanine is awesome. It's my opinion, not medical advice. L-theanine is awesome. I was just going to talk about, so L-theanine, magnesium. So these aren't necessarily depressants. Magnesium shouldn't make you fall asleep, but it will improve sleep stages once you do fall asleep. Magnesium is sort of this regulator. So when we talk about the stretch and the shear, calcium and glutamate binds this receptor called the NMDA receptor, which releases calcium. And the NMDA receptor involved in excitotoxicity, also involved in plasticity, but involved in excitotoxicity is gated. So like if I'm a gate right here and I open up, I'm plugged by magnesium. So I'm the NMDA receptor, I'm plugged by magnesium. And so if I don't have adequate magnesium levels, magnesium competes with calcium for entry into the cell. So basically NMDA receptor opens, calcium should kind of move. If I have adequate magnesium, I could theoretically mitigate some of the effects. And we'll talk about that next week in terms of prevention. But when we talk about it in terms of a regulator, calming the nervous system with mental, emotional, cognitive support, which is where I was moving anyway. So it feels like a tangent, but it's actually on track. Magnesium helps make sure that the neurons fire when they're supposed to and not fire when they're not. And so I did a newsletter, I think November 2019, so like 2 years ago or a year and a half ago, looking all at magnesium in the nervous system. And so in terms of calming the nervous system, I like L-theanine, I like magnesium, because it's this gate, it's this regulator. It competes with calcium for kind of exciting cells. And it kind of doesn't calm everything, but neutralizes, normalizes. I also like, there's a supplement called Lavella. Lavella is literally a lavender extract. And it has been found to go toe to toe with some some commonly prescribed anti-anxiety medications, which is pretty cool. So SSRI medications. Additionally, I like mind-body medicine. So we talk about all these supplements in terms of cognitive and mental emotional support, exercise, biofeedback, counseling, very, very, very important. We've got more and more research. I was just talking to my colleague across the hall. I've seen 3 papers in the last 2 weeks that are correlating pre-existing and like post-existing. So pre-existing anxiety, depression, trauma leading to post-concussion syndrome, like way more frequently in kids and adults. And then in terms of personality traits, having sort of these anxious, depressive, PTSD tendencies, you might not be clinically depressed, but you might just kind of have that where you like fall into a depression or you kind of are a little bit more anxious than your buddies. Having those predispositions before a concussion can make the symptoms last longer. It's not that it's going to make them, but it's correlated with longer lasting symptoms. So not addressing the mental health with mind-body medicine or with counseling or with biofeedback or whatever, not addressing your mental health is not addressing your concussion. That's just kind of what it is. The last point I wanted to talk about, because we're coming up on 30 minutes here, is hormones. I'm not going to talk about them in great detail, but what we know that I already talked about is like, if this is your pituitary, this is the cella turcica, hypothalamus is right here. Pituitary hangs below the hypothalamus and it sits in this bony structure. So when your brain jostles and shakes, this pituitary can dysregulate. And what we see is that if your hormones are kind of like a pyramid, the pituitary is at the top and it releases, hypothalamus stimulates the pituitary. And then the pituitary releases all these hormones to make everything else work. So luteinizing hormone stimulates testosterone. Follicle stimulating hormone makes your eggs and your testes do their thing. Gonadotropin releasing hormone gonadotropin releasing hormones, LH, FSH, testosterone, estrogen, things like that. You got growth hormone, you got thyroid stimulating hormone. Pituitary is the top of the pyramid. So if your pituitary is not working, your thyroid might not be working. Your testes and ovaries might not be working properly. Your growth hormone might be off. Your prolactin might be off, which we see elevated prolactin in the acute stages associated with cognitive symptoms. So in terms of persistent concussion symptoms, if you had like a hard enough hit, or you had a hit that jostled the pituitary, it's worth getting a panel looking at pituitary hormones, looking at LH, FSH, looking at the end products of testosterone, estrogen, looking at growth hormone, looking at prolactin, looking at these pituitary hormones. Again, not talking about that in great detail today, but knowing that the pituitary is a big player in the rest of your hormonal metabolic health, and knowing that it's involved in concussion, we definitely want to look at that if you're having persistent symptoms. So, rambly. All right, so so big recap. So acutely, we look at kind of the 4 pathophysiological things that we can do. We can structurally support the neurons. We can metabolically support regulating oxidation, regulating inflammation with antioxidants, anti-inflammatories. We can support, because there's an energy deficit, we can support with easy energy, and then we can prevent. In the chronic stages, we look at all the same things, but we're supplying energy not because there's a deficit, but because you're now working with compensations that aren't working. You're working with compensations that are giving you headaches, vertigo, dizziness, nausea, whatever. So let's support the rehab with some energy support. Let's support the cognitive, mental, emotional symptoms by regulating the nervous system with some like L-theanine, Lavella, magnesium, something like that. Let's go more aggressive at inflammation, like anti-inflammatory stuff, because now we're not so worried about halting the inflammatory process, but we're not worried about halting the acute inflammatory process. Now we're trying to halt this like aberrant, wonky, going on way too long inflammatory process. And then in terms of structural support, it might be less structural support up here and more structural support down here, and making sure you're not having like food triggers or unintended inflammatory episodes, unintended inflammatory intakes, because you're eating otherwise healthy foods that are causing this inflammatory kind of gut inflammation that's priming the microglia and having this cycle. So hopefully that made sense. It was kind of, I'm trying to show you the nuance between persistent concussion symptoms and post-concussion symptoms, because I see acute concussion and persistent concussion symptoms, because I see a lot of information on social media and a lot of functional medicine people kind of going way anti-inflammatory and not supporting any energy in the acute stages, or kind of mixing up what should be happening metabolically in terms of concussion. And I don't want it to confuse people. And hopefully this video didn't confuse more people than it helped. Next week, we're going to look at concussion prevention. So folks who are athletes, folks who are in the military, folks who have high-risk jobs, folks who work with those people or have children that are athletes. We're going to kind of be addressing how do we minimize the chance of a metabolic terrible concussion in the first place. So remember, you cannot have a severe concussion. You cannot have a mild concussion. You only have concussion. There's a mild TBI, there's a moderate TBI, and a severe TBI. But we don't grade concussion. So if you're going to have a concussion, like how do we minimize that so you have the fastest recovery? You're one of the athletes, you're one of the student athletes or the college athletes or whatever, who recovers in 21 days or who recovers in 30 days, rather than 59, 60, 73 years days. So we're going to talk about sort of metabolic prevention of concussion next week. This week was kind of the nuance of the difference between supplementation for persistent and acute concussion. And hopefully it made sense. Hopefully you guys appreciated that side rant on gut health. Thank you. I'll be logging off of YouTube here. And then I saw some questions on Instagram.